Good morning, everybody, and thanks for joining us here on KXAN Live. Will Dupree coming to you from the KXAN Live studio on this Monday morning. We're going to go now to a news conference that's underway featuring multiple leaders from both Austin and Travis County. They're really focusing on this naloxone, more commonly known as Narcan. This really proved instrumental in saving people's lives during a recent string of deadly overdoses throughout the city. Let's listen in as Dr. Desmar Walks, the local health authority, kicks things off.
Need for community-wide intervention. Today I'm joined by fellow speakers, Austin Travis County EMS Chief Robert Lukritz, Mayor Pro Tem Leslie Poole, Councilmember McKenzie Kelly, Travis County Judge Andy Brown, and Congressman Lloyd Doggett. I also want to acknowledge the partners here that make intervention efforts possible. The Texas Harm Reduction Alliance, Communities for Recovery, Central Health, Integral Care, and UT's College of Pharmacy and Center for Health Communications. To talk more about these kits and training that we've distributed throughout our community, I'll hand it over to Austin Travis County EMS Chief Robert Lukritz.
Thank you very much. I'm Robert Lukritz. I'm the EMS Chief for Austin Travis County EMS. I just want to speak to you a little bit about some of the efforts that our department has done, not just over the past few weeks, but over the past several years in trying to address the opioid epidemic. Safety of our community is our top priority. Addressing the opioid epidemic is critical for us, as it really is the first step in emergency medical services. While we may respond each and every day to emergencies across this city and across this county, if we can address these concerns before they happen, we are one step ahead of being able to provide a safer and healthier community. Our job overall is not just to save lives, but to improve lives and to be able to intervene at a point to be able to do that without having someone having a life-threatening emergency. Our team that addressed these concerns started over 15 years ago as a one-man team. And through the investment of our community, of our city, of our county, and our partners, we now have a team of over 50 individuals that are addressing social determinants of health, particularly the opiate crisis. We work around the clock, and we have a dedicated team of community health paramedics that are focused solely on opiates and substance abuse located within our community health paramedic team. Kudos to Captain Mike Sasser here, who joins us, and you'll be hearing from him a little bit later. Well, this was really his brainchild, to be able to address the concerns of the community and to be able to get ahead of these emergencies. The team has a wealth of knowledge and uses a multifaceted approach to opiate use disorder. Every time there is an opiate emergency in Austin or Travis County, our caseworkers, our community health paramedics, not only respond to the calls, but they follow up the next day and in the following days to offer harm reduction, education, and resources in an effort to get these individuals into treatment. We have a 93% success rate with our community health paramedics with the focus on opiates. The individuals that want to get help, we are able to successfully bridge them and get them into treatment, and work hard to be able to not just bridge those individuals, but to provide Narcan kits to individuals that might not be at a point where they're ready to get into treatment. We've heard, and it's been throughout the media, we had a significant surge in opiate-related incidents last week, or 2 weeks ago. More than a 1,000% increase in overdoses. What I think is key for folks to know, though, is that through the efforts of our partners here, through our community health paramedics and everyone that joins us today, 80% of those individuals received Narcan prior to the arrival from EMS. That is a testament to the ability to distribute Narcan kits throughout the community in an effort to save lives, and we want to continue to do those efforts. Our community health paramedics were out in the community immediately, deploying additional Narcan, distributing over 400 kits within 48 hours, preventing the surge from continuing to increase and being able to reduce the impact on the community over the next few days. But why are we here today? We're here today to be able to continue to grow that program. I want to assure you that Narcan is safe. It is something administered each and every day. And the more Narcan we're able to distribute into the community is more prevention that we have in reducing the opioid epidemic and being able to prevent these types of emergencies. In just a few minutes, we're going to be participating in a Breathe Now program where we're going to learn more about Narcan and how we can administer it and how we can address the acute emergencies that happen. It teaches recognition, administration, and pre-arrival care. We are on the front line of this epidemic. This community, our EMS and our partners here, and everyone that supports the opioid crisis here in Austin is on the forefront of this country. Organizations and cities across the United States are looking to Austin to see the innovative ideas that we have here, both in Austin and Travis County. Many lives have been saved, and each and every one is worth it. We're very excited now to recognize the funding that we've received over the past several years that have allowed us to purchase more than 7,500 Narcan kits that we will be distributing across the community. That's 15,000 individual doses of Narcan, and be able to train individuals through this Breathe Now campaign to be able to administer these. Again, I want to thank everyone. I want to thank Congressman Doggett for all of his efforts and being able to help us address these concerns. I want to thank our county judge and our county for the investments that they make into Austin Travis County EMS and the opiate crisis as a whole, and of course our partners and our leadership here in the city of Austin. And I'd be remiss for not recognizing all of the community partners, the community health paramedics, and everyone that puts effort into addressing this epidemic. Without them, there would certainly be more lives lost. I want to, again, thank you all for coming here, and I'm going to pass the microphone to Mayor Pro Tem Leslie Poole.
Thanks, Chief. I don't know if these mics are picking me up. They are? Okay, great. Hello, everyone. I'm Leslie Poole. I'm the Mayor Pro Tem of the City of Austin, and I'm here today representing Mayor Watson. Mayor's not able to be here today, but he echoes his support for the efforts we're addressing. On that note, I want to discuss just how important it is that we equip and train public-facing staff who are engaging with our community on a daily basis. This work can and will be a lifesaver. Similar to defibrillators in public places, staff at one of our libraries or park buildings may recognize a possible overdose and know how to administer naloxone before first responders arrive at the scene. This act will save lives. We've all heard stories from last week, the last 2 weeks, of bystanders stepping in and giving doses of naloxone to those who were overdosing. The more people we train and equip in our community, the greater the chance we have of saving lives and preventing tragedy. I encourage anyone watching to learn the signs of an overdose and carry and learn how to administer naloxone. Anyone can be the victim of an overdose. And now I'll hand the mic over to the Vice Chair of the Council Public Safety Committee, Council Member McKenzie Kelly. Thank you.
Thank you, Mayor Pro Tem. My name is McKenzie Kelly, and as the Mayor Pro Tem mentioned, I serve as the Vice Chair of the Public Safety Committee, in addition to representing the wonderful constituents of District 6. The opioid epidemic in our country remains a public health crisis, and what we experienced in Austin 2 weeks ago is undeniable proof that things are not going to get better on their own. That's why I have been steadfast in my support for the efforts of our dedicated first responders and ensuring they have all the tools that they need to save lives. During my tenure on the City Council, I have sponsored multiple resolutions focused on overdose prevention, harm reduction, and public education to provide continued funding for these critical initiatives. Just months ago, I was proud to help Austin Travis County EMS launch their Breathe Now training program, which is the same class you all will be taking in just a few moments. In less than a week, we lost 9 Austinites to unintentional opioid overdose. They were our neighbors, our friends, our sisters, and our brothers, real human lives that leave behind real human pain. This January, the harsh reality of this crisis touched my own life personally. We lost 2 family friends, a husband and a wife, to an unexpected fentanyl overdose. They were not known drug users, and their tragic passing is a somber reminder that this crisis can touch anyone. No one is immune, not even in my own circle, despite my role as an elected official. They leave behind 2 young children, and their entire family continues to suffer from this immense loss. Harm reduction works. Narcan saves lives. I have no doubt that without the hard work of our first responders and harm reduction partners, the death toll from the overdose surge would have been exponentially higher. This is not a partisan issue. Substance use disorder does not discriminate. It can be found in every corner of this country, and you would be hard-pressed to find someone whose life has not been affected in one way or another by this epidemic. I'd like to thank my colleagues on the Austin City Council for their support of harm reduction, as well as Congressman Doggett for his hard work ensuring that programs like these have the resources they need to continue to save lives. And with that, it is my pleasure to pass the podium off to Travis County Judge Andy Brown.
Thank you. Thanks everybody for joining us today. The overdose epidemic is a public health crisis that we see here in Austin, here in Travis County, and all across the country. It's not unique to us. Drug overdose deaths continue to be the #1 cause of non-accidental death here in Travis County. 2 weeks ago, we saw the largest opioid overdose outbreaks that we've seen in years here in Travis County. And thanks to the swift response of Austin Travis County EMS, the Austin Police Department, community partners, and just community members, they saved dozens of lives. About 3 years ago, the Texas Harm Reduction Alliance, represented by Maggie here today, let's do it, had a town hall where they brought me and other community leaders together to talk about the effect that opioid overdoses are having on our community and that we needed to do more. So 2 years ago, the Travis County Commissioners Court declared a public health crisis and made significant policy and financial investments into getting more Narcan, more training, more peer recovery, working with organizations like Communities in Recovery. And since our declaration, we've distributed something like 14,000 doses of Narcan, and I know the city has done a lot more, and other partners have done more too. And it really, what I'm trying to emphasize is it takes all of us coming together to confront this crisis. No one entity, no one group can do it alone. Community partners, the city, the county, the state, the federal government, to coordinate and implement effective strategies to tackle this public health crisis. And that's where Congressman Doggett comes in. It took him fighting for federal funding to increase access to overdose response kits here in Travis County, and I thank him for that. It took the collaborative efforts of the City of Austin, the Travis County Commissioners Court, and Austin Travis County EMS to respond by funding proven prevention and intervention initiatives that will save lives. And it's going to take all of us to get through this crisis. During the outbreak 2 weeks ago, TexCope, kind of a newer group to this, has a database that they have been working on, and they're actually able to alert potential, drug users up and down the I-35 corridor that there was a bad batch and to give them that resource. We signed on to be part of TexCope a couple of weeks ago to make sure that all of our data is going into that to try to help save lives as well. So thank you all very much for being here today, and please join me in welcoming Congressman Lloyd Doggett.
Thank you, Andy. I believe it's actually been 2 years that have passed since Judge Brown took the leadership with the county commissioners in declaring a public health emergency here. And despite the great work done by all of those who are here today, we still have the kind of challenge that we saw over the last couple of weeks. #1 cause of accidental death, 79 overdose calls in 5 days, 9 of our neighbors who are dead. Clearly, we don't have a panacea. We need as much prevention as possible, and where it is not, we need to save as many lives as possible. And that's what this effort has been all about. This is not just a problem that impacts the vulnerable homeless, though that would be reason enough to act, but it might be a grandmother who got hooked on this stuff after having a pain problem with surgery. It could be a high school student unaware that the drugs that he or she are using is something that's laced with fentanyl. We know from what happened here a couple weeks ago that this affected not just one part of town, but downtown, north, south, and east. Because of the enormity of this problem, I secured $2 million directly in a federal appropriation, not a grant. Thank you. This is an initiative to back up what our city leadership, the Harm Reliance reduction effort, and the county were doing. And it's all about looking for as many ways as possible to be helpful. I will certainly continue efforts to try to secure more in the way of support and backup. We've been urging the Biden administration to leverage every possible dollar available from the national opioid settlements as one source of funding. And we've also passed, which is surprising in this chaotic House of Representatives, the Support for Patients and Communities Reauthorization Act, which is about data collection, more federal grants, student loan repayment for some of those who work in this area, and programs for addressing trauma, particularly for children and youth that are associated with this. Like these Narcan kits that we are discussing this morning, we very much need to make fentanyl test strips just as readily available as the Narcan kits so this problem can be detected even before it's necessary to turn to Narcan. I'm pleased that there's been bipartisan support in Washington for doing this. Senator Cornyn is leading over in the Senate, but state law also has to be changed. We need both state and federal action, and it was very disappointing that we were unable to overcome the objection of some Texas Republican senators who blocked this important safety measure. So the next legislature, when it convenes in January, has bipartisan support for changing that, and I hope it can be done. We need an all-hands-on-deck approach to this. It is local, state, and federal because too many lives are being lost. I believe that the money that we secured, combined with what the city and the county are doing, will expand access to the Breathe Now training, which has gone into the work today. The Communities for Recovery and Texas Harm Reduction Alliance have expanded their teams. Austin Public Health is also building an increased capacity in a number of different areas, and Austin Public Health has improved its public health infrastructure by hiring an overdose prevention coordinator. All this about trying to provide the best possible care that we can and the best possible intervention. So salute to all of you who made this possible, and I'm very pleased to partner with you. And I think at this point to invite any questions from the media as we begin our training. Dr. Watts, are you going to lead that?
No, I believe we're going to go ahead and have the EMS first responders.
We'll take a few questions first before we kick off the training.
Yeah.
So,
Okay.
just for members of the public, where can they get this training, and where can they get the Narcan to have it potentially help in a situation like what we saw?
Training is available through the county, through HHS. We also have training available through EMS providers, and they can also get the kits through EMS and through Narcan vending machines that are located across our county, and from our Harm Reduction Alliance partners, Texas Harm Reduction and Communities for Recovery. And for those individuals who have the MAP card, they can get free Narcan from the community care pharmacies and also from HEB pharmacies.
I guess the situation now after what we saw a couple weeks ago is, are things kind of quote unquote back to normal, and where are you seeing the opioid hotspots right now?
Yes, things have seemed to stabilize for us here. All of those things are very fluid. New things like that could emerge at any given time, but at this point we are back to a normal stable point from where we were prior to the surge that we saw a few weeks ago.
Does Narcan expire?
Yes, it can expire. So you can look on the box that you've acquired from either the pharmacy or one of these locations that we've sent you to, and they'll have an expiration date on the box, and then follow that.
Can you go over the symptoms of an overdose so people know what they're
You may come upon someone who's not responsive or less responsive, drowsy, slurred speech, pinpoint pupils, difficulty with breathing, or they may have slow or no breathing at the time when you come upon them. They may have blue discoloration of their fingertips. And it's important that if you suspect an overdose, go ahead and use the naloxone, because it will resuscitate them if they have used a drug that is adulterated with fentanyl. It will not harm them if they haven't had fentanyl, but it will save their life if they have had a drug that is mixed or adulterated with fentanyl.
And the $2 million is new funding, right? You got some funding 2 years ago.
This is the implementation of that funding that I got previously, and we're after getting some more.
Obviously, you mentioned the testing strips. Any other challenges going forward that you see in trying to just tackle this problem? Funding probably is one, but just any others?
Well, I think it remains such an immense problem across the country. It's about getting the resources to do more of what we're doing today, and then getting the Narcan strips so that they're no longer considered federal drug paraphernalia or state drug paraphernalia. That would really assist saving lives, so that those who are addicted can find out if what they're about to consume is laced with fentanyl or not.
Yes, that we're in the process of distributing them in various locations across the county, and one of those locations, some of those locations will be libraries. You'll see them in different spots in the county. They'll also be at places where we've had reports of previous overdose poisonings. So we're doing a targeted approach to get to the high-risk areas first, and then we'll expand that capacity across the community.